Hello and welcome to City Vision University's Trauma and Recovery course. In this video, I will provide a brief overview of the course itself and also of the first lesson, a little bit more detail on that part. We are excited to be adding this course to our curriculum in the Addiction Counseling Department. It is an elective in this department and also can be taken as an elective for students in several of our other programs that would like more information on this important area that touches so many of our clients in nonprofits and ministries of all kinds. So we will be taking a look, first of all, at a big picture overview of the course, starting with the text that we have chosen and why these are the required reading for this particular class. We're using two main textbooks in this course. The first one is entitled Restoring the Shattered Self, and it's a little hard to see the subtitle in this view, but it is, in the subtitle, we see that it's a Christian counselor's guide, which is certainly one of the primary reasons we chose this particular text. There are obvious benefits of bringing Christian counseling into a trauma scenario. One of the primary healing components of trauma is hope, and we know the source of hope. So this is a primary text that we will be using. The course largely follows the order laid out in the contents of this particular text, and we'll look at that specific order momentarily. The other text that we will be using, it is a PDF download that's available online, and it is also linked in the course. So this isn't a text to purchase, but it is one of the tip guides, which are commonly offered by the Substance Abuse and Mental Health Service Administration, SAHSA. The addiction counseling students know their materials well. This one we are adding because it gives a focus for individuals that are dealing with trauma and yet may or may not be dealing with it on a clinical level. So an example might be a ministry that has basic services or perhaps case management, but not counseling beyond that. But they do often receive clients or guests that have trauma histories. And so the focus of much of this particular tip guide is on how to best approach clients with a trauma background that it can help them to begin to stabilize, help them to begin to feel safe. We will see when we get into our treatment units that safety and stabilization are crucial first needs for individuals with a trauma background. And so providing that for someone who is not dealing with them in a counseling or clinical setting is a vital addition that fits our student population. So we've added this particular Tip 57 guide from SAMHSA for the second text of the course. All right, so I want to give a bit of a view of how the course is going to go. This is the course outcomes. So what that means is this is what you should be able to do once you have finished this course. And most of these outlines do follow the course order as well, with the exception of this first one, describe the biblical view of pain, suffering, and trauma and healing. We are starting that this week in week 1, and we're defining trauma, and we're really looking at what it means, but then also some of those questions of why God allows trauma and suffering in the world. Now, we want to always end with a positive spin because it's not just about trauma, it's about recovery. And so the healing is a major focus that we will touch on a little bit here in week 1, particularly in the journal. And we're having a stronger focus on that part in weeks 7 and 8. The rest of the outcomes literally follow the course outcome. So we're going to begin next week looking at some of the different ways people respond to trauma. Why do some people react strongly and end up having life-controlling problems because of trauma, whereas others may have some resilience or be able to deal with some level of traumatic experience. So we're going to look at different things that can impact that and have an influence. Then we start in weeks 3 and 4 looking at symptoms, recognizing trauma, and defining some trauma-related disorders. So these would be official diagnosable conditions. And then the final part of that outcome is assessing these symptoms. So for those who would do a formal diagnostic assessment, it would be what would those symptoms be and how would we tell if a person really has a specific trauma-related disorder or something that is perhaps some temporary but passing reaction to a traumatic event. Then we get into the actual treatment portion. So we're going to look at the theories of trauma and trauma-related disorders, and then how they are assessed and treated. That is weeks 4 through 6. We will be in the mid part of the class dealing quite a bit with the treatment process. As I mentioned when explaining the 2 textbooks, we will be dealing with that from 2 different viewpoints. One for those who plan to formally treat clients, but then others who deal with clients with trauma backgrounds on a daily basis, but won't be doing formal clinical counseling. In week 7, we will look directly at what is the connection between trauma and various types of addictions, including substance use disorders, but also things like behavioral addictions. And then in week 8, we're going to look at the impact of trauma, not only for our clients, but for ourselves. And we will ask each of you to examine your own current level of personal healing from any past trauma and what those next steps will be to find your own way to full recovery from past trauma, and also when working with clients in this context to avoid something known as secondary trauma, where the element of understanding and hearing the stories of clients has an impact on the person that is working to help them. So I hope you are a little bit more excited about this class. And this outline is the final thing we're going to take a look at. It really just goes over week by week what that outline is going to be, as we just discussed in the outcomes. But this is listed in the lesson menu in the course as well, and we'll give you just a visual guide of the things that we will be taking a look at and what to expect as you work your way through these materials. Of course, please do not hesitate to reach out to any of the faculty as you are going through the course and let us know what questions you have. Thanks. We look forward to these next 8 weeks.